Hello, and welcome to TruceTalk, the podcast where we come together to support our heroes, both veterans and active duty service members, as well as civilians from all walks of life. I'm your host, Lenzy, your certified clinical hypnotherapist and hypnotherapy instructor, dedicated to helping you find relief from the burdens of fear, anger, panic, grief, anxiety, depression, and PTSD. Here at TruceTalk, we understand the struggles you face, and we want you to know that your feelings are valid. You're not in this journey alone, and there is hope for healing and transformation. If you're ready to take the next step, I invite you to visit our website at www.trucetalk.com. There you can click on the Contact Us page to schedule an appointment or share your story with us. For those of you seeking to schedule an appointment through the Veterans Healthcare System, please remember that you can request an authorization from your primary care provider to see me by name. Your well-being is our priority, and we're here to support you every step of the way. If you find value in our discussions today, please like, follow, and subscribe to the TruceTalk Hypnosis blog. You can also connect with us on Instagram at TruceTalk and join the conversation on our new YouTube channel using hashtag TruceTalk. Together, let's create a community of healing and hope. Thank you for being here, and let's get started on this journey together. In this episode, we'll explore the intricate world of the human mind and the challenges that come with it. And we will unpack the DSM-5 criteria for hoarding, explore the psychological underpinnings of this condition, and begin to understand the journey toward healing. So welcome back to this space of relaxation and exploration. As you prepare to listen to today's episode, I invite you to find a comfortable position, allowing your body to settle in. Take a deep breath in and slowly release it. With each breath, feel yourself becoming more relaxed, more and more at ease. Inhale deeply and exhale slowly, letting go of any tension or stress. Allow your shoulders to drop, your jaw to relax, and your mind to quiet. Now, picture a gentle wave of calm washing over you, starting at the top of your head and flowing down through your body. With each breath, this wave brings a sense of peace, washing away any distractions or worries. As you relax, I invite you to open your mind to the insights we will explore today about the impact of hoarding on relationships and daily life. Imagine your mind as clear as the sky, ready to receive the light of understanding. With each word I speak, you will find yourself becoming more and more receptive to the messages that will unfold. You are here to gain awareness, to foster empathy, and to embrace the journey of healing. Take one more deep breath in, and as you exhale, let go of any remaining tension. You are ready to begin. The impact of hoarding on daily life. This is episode 2 of the series. This episode is Living in Chaos: How Hoarding Affects Relationships and Daily Functioning, according to the DSM-5. This is TruceTalk, where now we delve into the complexities of the human mind and the challenges we face. Again, I'm your host, Reverend Charles B. Lenzy, certified clinical hypnotherapist and certified hypnosis instructor. And today, we will explore a topic that resonates deeply within many: the impact of hoarding disorder on relationships and daily functioning. In our previous episode, in case you missed it, we unpacked the DSM-5 criteria for hoarding disorder and hypnosis and began to understand the psychological underpinnings of this condition. Today, we will take a closer look at how hoarding affects not only the individual, but also their loved ones and daily life. So, let's embark on this journey together. Now, to fully appreciate the impact of hoarding disorder, we have to understand the nature of hoarding disorder. And it's essential to revisit what hoarding truly is. Because as we discussed, hoarding disorder is characterized by persistent difficulty in discarding possessions, leading to clutter that disrupts living spaces and impairs daily functioning. This disorder is not merely about having too much stuff. It's a complex interplay of emotion, cognitive, and behavioral factors. Individuals may feel an overwhelming attachment to their belongings, often viewing them as extensions of themselves or as repositories of memories. This emotional connection can make it incredibly challenging to let go, even of items that may seem trivial to others, as you may have seen in the video. As we explore the effects of hoarding, we must recognize that it extends beyond the individual and permeates their relationships and daily life. And as you saw on the TruceTalk Hypnosis YouTube channel, the individual I was interviewing expressed how hoarding disorder can have profound effects on relationships when she stated that we removed 7,200 gallons of garbage from that home that was no longer inhabitable and about to be confiscated by the city. You see, family members and friends often find themselves in a difficult position, torn between love and frustration. They may even feel helpless as they witness the clutter accumulate in that case. And this can lead to feelings of embarrassment, shame, and even anger. Especially if the individual has a professional occupation in which they are expected to help others. There's often a communication breakdown. The clutter can create a barrier to open communication. Family members may avoid discussing the issue, as in that case, fearing it would lead to conflict. But this silence can breed resentment and distance, making it harder for loved ones to connect. And then there's isolation, because individuals with hoarding disorder may isolate themselves due to the shame associated with their living conditions. They may even avoid inviting friends or family members over, leading to a sense of loneliness and further exacerbation of the disorder. And then perhaps role reversal. In some cases, family dynamics shift. Loved ones may take on caretaking roles, managing the clutter, or even making decisions about what to keep or discard. But as you saw in the video, this can lead to resentment and loss of autonomy for the individual struggling with hoarding. And it does take an emotional toll. The emotional burden of hoarding extends to family members as well. They may experience anxiety themselves, depression, and stress, or even eating disorders as they navigate the complexities of their loved one's condition. It's essential to recognize that hoarding affects not just the individual, but the entire family system. Now, let us turn our attention to how hoarding disorder impacts daily functioning and overall quality of life. The clutter and garbage that accumulates can create significant barriers to everyday activities. As the City of Mary Esther's inspector pointed out in his complaint and stack of papers that he delivered, safety hazards, complaints. One of the most pressing concerns is safety, he stressed. Clutter can obstruct pathways, making it difficult to navigate the home. This clutter can increase the risk of falls or accidents, posing a danger to the individual and anyone who enters the space, or in that home, even entering the property. And then there's difficulty with daily tasks. Simple tasks, as you saw in the kitchen, such as cooking, cleaning, or even finding essential items, had become and can become monumental challenges. The overwhelming nature of the clutter can lead to feelings of frustration and helplessness. And then difficulty with daily tasks. Even simple tasks such as cooking, cleaning, and then the impact on social life and work. Because hoarding can also affect an individual's professional life. The stress and anxiety associated with the disorder may lead to absenteeism or even decreased productivity, or maybe even complaints from clients if you see clients in your home. Social interactions may dwindle as individuals withdraw from activities that involve leaving the house or inviting others in. And of course, there are the mental health consequences. The emotional toll of living in such chaos, as you saw in the TruceTalk video, Why Are You Still Hoarding, on YouTube, can lead to increased anxiety, depression, and feelings of utter worthlessness. The individual may feel trapped in their situation, especially if the hoarder is their benefactor, leading to a cycle of despair that can be difficult to break. Understanding these impacts is crucial for both individuals struggling with hoarding and their loved ones. It highlights the importance of seeking help and support, which is when the Lenzy Clinical Hypnotherapy Institute was asked to step in. And I introduced my TruceTalk Hypnosis modality, which I will be offering training courses in starting in the summer. You can visit our website at www.trucetalk.com to send me an email or follow us on Instagram or YouTube to inquire. Now, as we navigate the complexities of hoarding disorder, it's vital to approach the situation with empathy and understanding, because those affected by hoarding are often grappling with deep-seated emotional issues, and their behavior is not simply a matter of choice or laziness. It requires recognizing the struggle. It's important to recognize that hoarding is a mental health condition. Individuals may feel overwhelmed by their possessions, and the thought of letting go can trigger intense anxiety. Understanding this can help loved ones respond with compassion rather than the frustration. Avoiding judgment at all cost. Judgment can create a barrier to open communication. Instead of labeling the behavior as messy or irresponsible, it's more helpful to approach the situation with curiosity, as I did. Ask questions and listen to the individual's feelings about their possessions. This can foster a sense of safety and openness. After this, insight can be gained, and then encouraging professional help. While empathy is crucial, it's also important to encourage individuals to seek professional help. Mental health professionals can provide the necessary support and strategies to address the underlying issues associated with hoarding. This in itself can be a delicate conversation. But as you witness in the video series, expressing concern for their well-being can be a gentle way to introduce the idea of seeking help. Creating a supportive environment is very important. Family members and friends can play a significant role in creating a supportive environment. This may involve setting boundaries, offering assistance in a non-judgmental way, and above all things, being patient as the individual navigates their journey toward healing. Because as you see, it took 10 months for me to clear that house completely and allow the healing and the rebuilding to begin. So now that we've discussed the importance of empathy and understanding, let's explore some practical strategies for supporting loved ones who may be struggling with hoarding disorder. Open communication. Encourage open dialogue about the issue. Create a safe space for your loved one to express their feelings and fears without fear of judgment. This can help build trust and strengthen your relationship. I was wearing a medallion around my neck from a fraternity that caught the eye of that hoarder, and it reminded him of his father, who was also a member of the same fraternity. And from there, the open communication began. And then we were able to set realistic goals. Because if your loved one is open to it, work together to set small, achievable goals. This could involve decluttering one area of the home at a time, or sorting through a specific category of items. Celebrate progress, no matter how small, to foster a sense of accomplishment, as we did. Offer practical help, because sometimes the sheer volume, as you saw in that video, of items can be quite overwhelming. Offer to help with sorting, organizing, or even just being present during the process. Your support can make a significant difference in their ability to tackle the clutter. Encourage professional support, as mentioned earlier. Professional help can be invaluable. Encourage your loved one to seek therapy or counseling, and offer to assist them in finding qualified mental health professional who specializes in hoarding disorder, or someone who has been trained in TruceTalk hypnosis. Practice self-care, because supporting someone, as you heard me explaining to the lady in the video, with hoarding disorder can be emotionally taxing. It's essential for caregivers and loved ones to practice self-care. Perhaps exercising if your physical condition can sustain it, or maybe even begin taking a Pilates class, as they did. This may involve seeking support for themselves, whether through therapy, support groups, or simply taking time for personal interest and activities. your path forward can be quite clear with the benefits of TruceTalk hypnosis, as you saw in the video, and the subsequents coming to show you the end result. As we conclude this episode, I want to emphasize that while hoarding disorder can create significant challenges, there is hope for recovery. Understanding the impact of hoarding on relationships and daily functioning is a crucial step toward healing. The journey of healing, recovery from hoarding disorder, is a journey that requires time. In this case, it took 10 months. And with patience and support, it is important to recognize that setbacks may occur, but progress is possible. Each small step taken forward, decluttering and addressing emotional barriers, is a victory. The role of hypnotherapy? Well, in our next episode, we will explore hypnotherapy as a potential treatment for hoarding disorder. This particular therapeutic approach can help individuals access their subconscious thoughts and beliefs, allowing them to reframe their relationship with their possessions and develop healthier coping mechanisms. So if you or someone you know is struggling with hoarding, remember that you are not alone. There are resources and support available to help navigate this complex condition. I want to thank you for joining me today as we explored the impact of hoarding disorder on relationships and daily life. I hope this discussion has provided valuable insights and fostered a greater understanding of this often misunderstood condition. And as we wrap up today's episode, I want to express my gratitude for your willingness to engage with this important topic. Understanding hoarding disorder is a vital step for addressing hoarding, with a particular focus on clinical hypnotherapy. I look forward to sharing more insights and strategies that can aid in the healing process. Hypnotherapy in particular offers a unique approach, as you saw in the videos, and we'll see in the videos coming forward, to addressing the underlying emotional and cognitive patterns associated with hoarding disorder. And as we conclude, I encourage you to take a moment to reflect on what we've discussed today. Consider how the insights about the impact of hoarding on relationships and daily functioning can inform your understanding of this condition, whether for yourself or for someone you care about. Remember, healing is a journey, and every step taken, no matter how small, brings us closer to a more fulfilling and organized life. And my dear listeners and fellow hypnotists and hypnotherapists, we're thrilled to invite you to be a part of our podcast community, where we explore the fascinating world of hypnosis and the art of therapeutic change. Doesn't matter whether you are a seasoned practitioner or just starting your journey. We understand that the path can sometimes be challenging. And if you find yourself grappling with techniques, client interactions, or any aspect of your practice, we want you to know that we can create a supportive environment for growth and learning. And I'm also excited to offer a unique opportunity for those who wish to dive deeper and deeper into their practice. If you're interested in participating in a live session on the TruceTalk Hypnosis show, I invite you to volunteer. This is a chance to work through your challenges in real time, gain insights, and connect with the community of like-minded individuals. To share your thoughts, questions, or to express your interest in a live session, please reach out to me at www.trucetalk.com. I look forward to hearing from you and embarking on this transformative journey together. Thank you for joining me on this episode of the TruceTalk Hypnosis podcast. It's been an honor to share this space with you, to validate your experiences, and to offer hope for a brighter tomorrow. Remember, healing is a journey, and you don't have to walk it alone. If you're ready to take the next step, don't hesitate to visit us at www.trucetalk.com. Whether you want to schedule an appointment or share your story, I'm here for you. And for those of you navigating the Veterans Healthcare System, remember to request an authorization from your primary care provider to see me by name. If you found our conversation helpful, please take a moment to like, follow, and subscribe to the TruceTalk Hypnosis blog. Connect with us on Instagram at TruceTalk, and join our growing community on YouTube with #TruceTalk. Your support helps us reach more people who need to hear this message of hope and healing. Until next time, take care of yourself and each other. Remember, you are not alone, and together we can find peace and resilience through hypnotherapy. Thank you for being part of this TruceTalk family. I'm Lenzy. I'll see you soon.